Hello everyone, my name is Christian Rathgeb from the University of Applied Sciences in Darmstadt, and the work I'm going to present is entitled Plastic Surgery, an Obstacle for Deep Face Recognition. This is a joint work together with my colleagues Didem Dogan, Fabian Stockhardt, Christoph Busch, and Maria de Marsico from the University of Rome. This will be the outline of my presentation. First, I will give a brief introduction on the topic and the question we try to answer. Subsequently, I will summarize the used and newly collected face image databases. Then I will describe the conducted experiments, and finally I will draw some conclusions. Now, the impacts of plastic surgery on face recognition have been well studied for several years, mainly using a single public database. It was found that alterations induced by plastic surgery may drastically decrease the performance of various face recognition systems. In the figure on the right, you see face images of celebrities before, in the top row, and after plastic surgery, the bottom row. However, the accuracy of face recognition systems has been greatly improved in the past years. Therefore, it is necessary to re-evaluate if this is still the case for deep face recognition systems. To this end, we collect a new plastic surgery database and perform several experiments to answer the question whether plastic surgery is still an obstacle for face recognition. For our experiments, we use the well-known IIITD plastic surgery face database. In addition, we collect a new plastic surgery face database, which comprises images before and after the most popular plastic surgeries, namely eyebrow correction, eyelid correction, facelifts, nose corrections, and facial bones corrections. Example images are shown on the right. The collection of this new database was mainly motivated by the fact that face images of the IIITD plastic surgery face database are of rather low quality. Further, a non-surgery database is used for comparison. Properties of all databases are summarized in the table on the left. As can be seen, we aimed at collecting around 100 image pairs for each of the five most popular types of plastic surgeries. In our experiments, we evaluated two state-of-the-art face recognition systems, the commercial Cognitec system and the well-known open-source ArcFace system. We perform identification experiments in which we evaluate the rank 1 recognition accuracy. Further verification experiments are conducted in terms of false non-match rate and false match rate. Precisely, we evaluate the false non-match rate at a fixed false match rate of 0.1%. In this table, you can see the results of the identification experiment. It can be observed that rank 1 results on the plastic surgery databases are similar to those observed in the absence of plastic surgery. Example images of the IIITD plastic surgery face database are shown in the figure on the right. The very same holds for verification experiments. Obtained score distributions together with the decision thresholds, are depicted on the right. A decrease in genuine comparison scores can be observed across both plastic surgery databases and for both face recognition systems. However, considering the operation point yielding a false match rate of 0.1%, this decrease has almost no effect. The commercial system maintains a perfect verification performance where only a marginal decrease in comparison scores is observed. Similar results are achieved for the open source system, where only a couple of phased images of the plastic surgery databases are rejected. This already brings us to the conclusions. The most important finding of this work is that state-of-the-art face recognition systems have become very robust to alterations induced by plastic surgery. While previous work have achieved about 95% rank 1 accuracy on the IIITD plastic surgery face database, almost perfect rank 1 values were achieved in this work. The same holds for the verification, which was hardly been analyzed in previous works. When analyzing problematic image pairs, it was found that facial bone corrections and eyebrow corrections have the most severe impact on comparison scores of both tested systems, in particular when applied as part of so-called feminization surgeries. Facial bone corrections may prevent from reliable recognition. Example images are shown here. This concludes my talk, and I would like to thank you for your attention.